10, the Honourable Maryan Street.
Thank you, Mr Speaker. To the Minister of Health, does he stand by all his recent statements on health?
The Honourable Tony Ryle.
Mr Speaker, within the context they were given, yes. And I also stand by, despite the world's deteriorating international debt crisis, we've invested almost $2 billion extra into health over our 4 budgets. This huge investment is best put into perspective by the OECD's latest report that reveals while the average OECD nation had a nil increase in health spending, New Zealand had the 3rd highest of 27 OECD nations in increase in health spending in the latest year available.
The Honourable Maryan Street.
To the Minister, given his statement to the House on the 15th of August 2012 regarding the number of nurses added to the health workforce since coming to office, is he aware of a recent Massey University study that indicated that nearly half of the nurses surveyed were considering leaving because of distress caused by feeling that they can't deliver the care they want to because of management pressure to reduce costs? And does he recognise this as a crisis within the nursing workforce, as the survey does?
The Honourable Tony Ryle.
Mr Speaker, I did see a report of that survey. I think our nurses work extremely hard, and certainly I'm very pleased to see the member acknowledge that we now have over 2,000 extra nurses working in the public health service since the government came to office in 2008.
Supplementary.
The Honourable Maryan Street.
To the Minister, given his statement of 16 of August 2012 regarding additional elective surgical procedures achieved by DHBs, which services is he happy to see the DHBs cut in the light of reported comments by the Manager of Surgical Services at Nelson Marlborough District Health Board that they were not funded to do all their operations and had to find resources from elsewhere?
The Honourable Tony Ryle.
Mr Speaker, it's true to say that many district health boards did do more operations than was set in their health target. In fact, the information that will be released with the health targets will indicate that DHBs put some of their own resources into achieving more operations. You've got to remember that under the previous government, they put more money into the health budget, doubled the health budget, and got fewer operations on a population basis. We are getting more operations for New Zealanders, and actually we're getting them faster, and I think people are very, very happy with that achievement.
Point of order.
Point of order, the Honourable Maryan Street.
Point of order, Mr Speaker. I asked which services the Minister would like to see cut, given that there was underfunding for the surgical procedures that they achieved. That's the question.
Well, to avoid, I'll allow the member to repeat a question, but I'll listen very carefully to the answer, and I want to make sure that the Minister hasn't previously answered it. The Honourable Maryan Street.
Thank you, Mr Speaker. Given his statement of 16 August 2012 regarding additional elective surgical procedures achieved by DHBs, which services is he happy to see DHBs cut in the light of the reported comments by the Manager of Surgical Services at Nelson Marlborough District Health Board that they were not funded to do all the operations and had to find resources from elsewhere?
The Honourable Tony Ryle.
Mr Speaker, it's up to DHBs how they spend their budgets. What I can say is that the Nelson Marlborough District Health Board got $12 million extra last year on top of funding available for electives, I understand, and they also got an additional $12 million this year. So DHBs are getting more money, providing more services, they have more doctors, they have more nurses, and actually in the toughest economic times that a country has faced for generations, that's a great service for patients from the New Zealand Public Health Service and the John Key-led national government.
The Honourable Maryan Street.
To the Minister, given his statement of 15 August 2012 with respect to the voluntary bonding scheme for doctors, nurses and midwives in hard-to-staff regions, can he confirm the statement of Rural Women New Zealand, who said that the scheme has failed to attract any rural GPs and the problem of access to GPs in rural areas is now urgent?
The Honourable Tony Ryle.
Mr Speaker, I don't agree with those comments because the voluntary bonding scheme is beyond just doctors. I don't think we should have a health service that only looks at doctors. We've got many GPs who have enrolled on the scheme. A large number have applied and are being considered. We've also used the scheme to support additional midwives in rural areas. I think that it's working out very, very successfully, and the level of interest would indicate that.
Question number 11, Mike Sabin.
Thank you, Mr.
Order.
Speaker. To the Minister of Housing, what is Housing New Zealand doing to identify